Welcome to the Ethics Experts, where we're elevating ethics and compliance and HR to the strategic level it's supposed to be.
What's up, Jordan? How's it going, man?
Good. I'm glad to be here and, excited to have our discussion today. I've been following recently your podcast and your work in compliance, so it's really exciting to be here.
Well, thank you very much. Thanks for saying that. Yeah, the feeling is mutual. Been looking forward to having you on the Ethics Experts. We had a really good, pre-show call, and I can always tell how good the episode is going to be based on that pre-show call. So maybe before we get started, just maybe tell everybody a little bit about yourself, the role you sort of play in this space, and then we can kind of dive in.
Yeah, I could give you a quick little background. So I've been in healthcare going on 20 years now. I started out in the pre-hospital space, so working and volunteering as an emergency medical technician. I was born and raised in New Jersey, so it's a very, high volume area for EMS. From there, I went to formal education. I did my undergraduate work in public health at Rutgers University, and I was kind of blessed to then get an internship with the New Jersey State Department of Health. So I was in a regulatory capacity there. We were the regulatory body over EMTs and paramedics. So we did a lot of compliance related work, a lot of, administrative code and, the like. After that, I did my master's in healthcare administration. I moved on to the private sector for a little bit and did consulting, mostly in emergency management. That's where I was in the second half of my stint at the New Jersey State Department of Health. After that, the pandemic occurred, and I got two positions, one which I'm still involved with today, which is with the U.S. Department of Health and Human Services Incident Management Team. So really what we do is when the federal government deploys any personnel, assets, or equipment, throughout the country or our territories, we go out as that incident management team coordinating all of that, on site, for the resources in that deployment. The second role, which is where it gets more germane to why we're here today, was with the CDC Foundation, where I was assigned with the New York State Department of Health for their Surge Operations Center. I ran the Surge Operations Center during the back half of the pandemic. It was a very interesting, exciting role. We were mostly remote. We had, 6 functional units working from, offloading patients from one hospital to another, to equipment requests and resource requests. I'm sure a lot of the listeners are familiar with when, hospitals were asking for ventilators or face masks or anything like that. We were that nerve and coordination center where they would go and, hey, we need X, Y, Z. It was towards the end of this that ChatGPT was released to the public. I believe it was late 2022. And that's when the light bulb clicked, if you will. And I go, okay, even in the iteration that ChatGPT was released in, it could have been such a force multiplier for us responding to the pandemic, especially because we were mostly all remote. So having a tool like that, would have been huge, because we were working with very thin margins of personnel, as you can imagine. So at that point, I really put my head down and reskilled and upskilled in AI. As you could tell from my background, I'm not in computer science or IT, but I've always had that ethical ethos. So I found my niche, if you will, in AI. So I'm really focused on applied AI ethics, compliance, and governance, and then overall, operational strategy. So for the last few years, besides the upskilling, I've been offered and onboarded to several AI MedTech startups in advisory board roles and also consulting. I did start my own consulting firm about 1.5 years ago, Veritas AI Consulting. So I use that as the umbrella to, do my work in AI ethics and compliance. In that time, I got another master's in organizational leadership from University of Maine. And, just excited about continuing in this space and seeing where it goes, because it's every day is an adventure, as you imagine.
Yeah, my gosh. What a background. We could probably talk for hours about that background. My gosh. Let's go back though to the beginning.
Sure.
What were you like growing up? What kind of a kid were you? What kind of a family did you come from? And what do you think set you on this path that, the first intersection with this path sounds like it was as an EMT. What pushed you down that road?
So, I do come from a single mother family home, but I was raised a lot by my grandparents. And they lived in the same town, maybe like 5 minutes away, bicycle ride away. So I would spend a lot of time with them during the week. My mother worked a lot. And it was my grandfather, I believe, who really instilled that ethical, servant leadership, volunteerism in me. I remember going back as young as 12 years old. And I'm sure we all remember Kmart's. I don't think they exist anymore. But we were volunteering outside of a Kmart doing, a coin donation drive for Muscular Dystrophy Association. And we would do it every year, when they used to have the telethon. I think it was Jerry Lewis who did it. So we'd do it like a month or two beforehand and, collect the money and send in. That kind of led me down a path where I joined DMLA, which was a young men's civic organization, which was very heavily focused on volunteering and giving back to the community. So there was many, from helping, the elderly woman down the street to landscaping projects, everything you can imagine, fundraising. And then, shortly after that, I was introduced to the fire service, which I spent a little bit in. It wasn't my thing. Have nothing bad to say. It just wasn't.
Too much sitting around, huh?
Right. Yeah. So I didn't want to do it. But someone had said, hey, why don't you join the local rescue squad as a volunteer? You could start at 15 and then start riding an ambulance at 16. So that was really my first foray, into a more traditional role that was, service related. But it really started, at the young age of 12.
So how did this sort of concept of servant leadership that your grandfather kind of instilled in you, how did that show up in that EMT role, and how have you carried that forward throughout your compliance work?
Yeah, I think with servant leadership and ethics, tied together here, in the back of an ambulance, you're making split second level decisions. So it's literally can be life or death. It's not always that, but it can be. So it's, how am I going to literally treat this person so that the greatest outcome can occur? So, you have to develop that on the fly. Of course, you're going to train, you're going to have the formal education, you're going to have people like a field training officer telling you things in the field. But when you're alone, in the back of an ambulance with a patient, it comes down to that second. So, having a servant leadership mindset is, I'm going to give everything to this person to hopefully turn their situation around. And, there's no ethics by committee in the back of an ambulance. So again, you have to make those decisions then, So, you kind of have to, it sounds like, develop some sort of like ethical framework or some kind of action oriented framework, sitting in the back of that ambulance, as an EMT. What do you think some of the corollaries are in terms of the work that you did later with the CDC and then on into your, your current role? And do you see any kind of connection points there? I do. And I think it's more of like a building block approach, like a development, as I'm maturing. So like in the back of an ambulance, it's, it's operational based. You're there. It's one-on-one most of the time. As I moved on to more public health response, so whether that be with the U.S. Department of Health and Human Services or CDC Foundation, it becomes more of a systems level ethics and policy approach, if you will, so that it's more established, but you're working on those larger frameworks and structure. And then I think today, with AI ethics and applied AI, governance and compliance, you don't know technically how big you're dealing with. So is that AI touching just a local amount of people? Is it the whole region? Is it the country? Is it international? So you have a much greater effect on the outcome of what is going on ethically. So you have to ensure that your ethical framework, personal ethical framework, is sound before you move into such a novel, sector like AI and applied AI ethics.
So, this is such an exciting time in our lives and in sort of every respect with this new technology that seems like it's going to revolutionize everything. You talked a little bit about this light bulb going off when ChatGPT came out, and you were reflecting back on how much that would have helped in this sort of remote environment during COVID, when you're distributing, ventilators and all these other materials, all this coordination that was necessary. Talk to me a little bit about that light bulb and like where you think this is going, not just, both in terms of kind of the general, workplace, but also specifically in the healthcare side.
Yeah, I mean, so, specifically for an example of how, we could have applied that during the pandemic, like I was saying, there's a lot of supplies. So whether that be durable medical equipment, face masks, gloves, whatever it may be, you're dealing with so many different streams of supply chains. So you may not be getting all of that from one vendor or all of that from one region. So you need a higher level of management for what that is coming in, not only inventory management, but burn rate. And then what's your back supply? So do you have, from that vendor, 10 more weeks of whatever that is, right? Let's say medical gloves. So then you implement a tool like ChatGPT into that framework, and then it acts as your conductor, if you will. It's a crude way to say it. But, we have in emergency management, you may hear this colloquially, but, a lot of times we'll say we have a lot of spinning plates in the air and you have to keep going around and make sure they're spinning. Well, the AI could have kept your plate spinning while you're focused on more, traditional, higher level decision making or human in the loop, decision making. And I think, again, those same applications apply today. Because AI isn't, or generative AI or the large language models, open models, are not ubiquitous in every, agency of the government from local to federal. They're becoming integrated and implemented. But I don't think they're at the time now when we go, okay, that's our main conductor for this response. There's still a lot of test trials going on. So I think AI in healthcare and emergency management and public health is that force multiplier. Real quick segue, towards the end of the pandemic, all of the CDC Foundation surge workers were let go. There was about 5,000 of us. Some did find work with the local or state health department they were working for, but most did not. So almost everyone was left in the cold, with federal grant money coming in. So I use that example only to illustrate that AI is your force multiplier. It's your bench, if you will, if using a sports
it's sort of excess scalable capacity.
Right. At the very least, obviously the capabilities are so much more than that. And I understand that, from disease modeling to situational awareness to weather from the sky or from the ground. So what is your, flood mitigation and all that. So there's so many uses, obviously, in healthcare. And I think they're still developing today.
So if somebody's new to this space and they're, they don't know what you're talking about with applied AI ethics governance, how would you kind of break that down in sort of practical terms? How should we be thinking about this concept that is probably going to be, if it's not already, a major sort of consideration or a major part of our vocabulary going forward?
Right. So, I mean, the one of the easiest ways, and I tell this to my grandmother who's almost 90, to, nephews who are in their teens, you can ask AI, generative AI, the open models, ChatGPT, Grok, Gemini, etc. You can ask it anything and it's going to tell you. So you ask it and you tell it, hey, I'm at an 8th grade learning level, or I'm at a 10th grade learning level, or I'm a PhD level learner. It's going to feed back to you the information you're asking it. So I tell my grandmother, I say, ask her what you want to know. And she'll go, what is AI? Right. Because she's, pretty clueless. I mean, the internet and Facebook just came around for her. So ask simple questions. Now, if you're a compliance practitioner and you're like, how do I begin here? I'm working in whatever field and I don't know how to begin implementing. There are governance standards and frameworks out there. There's no national standard yet. I know the federal government and stakeholders are working on it, but it's not there yet. In Europe, you have the EU AI Act, so you have a general, foundation. Here we have some state by state legislation like New York and California, Colorado, etc. But in general, you're working off, various mechanisms. So governance standards, ethical frameworks. There's more formal ones like the NIST RMF framework, or ISO 42001. So I would say, depending on your industry, pick up one of those and start looking at it. And then again, feed that into AI. Hey, I don't understand this whole section. I don't understand this. I'm the compliance officer for this healthcare startup, and we need to start building from the ground up, compliant frameworks. Right now I'm also a board member with the Institute for AI Governance in Healthcare, and we put out our healthcare AI governance standard, which it surpasses, the requirements of NIST and ISO and EU AI Act. So
if I can pause you on that, talk to me a little bit about NIST, the ISO framework, relative to some of these like patchwork things that we're starting to see in California and New York. Like, where are the gaps? What, where is this going? Like, what's the overlap right now? And like, where are some of those gaps? And then I'd love to hear a little bit about this, this governance framework that your, this healthcare AI governance organization is building, and what gaps that kind of fills, because I think this is not the EU thing, right? Like EU, they at least have something. We can have a whole probably debate about the efficacy of that and the extent to which that this, the risk surface area, given new use cases, is already kind of extending beyond the bounds of that document, so to speak, that has already been put out. But I think the patchwork over here is very interesting and creates a lot of anxiety, to your point, at the practitioner level of like, okay, what do I do with this new thing? This new thing's coming in. What do I actually do with it?
Right. Yeah. And you're correct. I mean, it's a patchwork at the moment. Of course, we're literally in the beginnings of AI. Even though it's been around for 4 years, since ChatGPT, it's obviously been around before that in large language models. So I would say, like, these are different frameworks by different entities or associations. So like ISO is a huge standardization across many industries. They're one of the benchmark, certifying bodies in that. So ISO gives you another governing standard for AI. So from building AI up in your company, how do you implement the guardrails, bias audits, red teaming, everything, all you need to manage. Again, the NIST RMF framework, a risk management framework, again, goes into more of that risk side of it, risk management side, rather than the complete technical side of ISO. And then, of course, you have other state laws who kind of pick things from each, right? And you're making that patchwork. What we, and I won't claim credit, the CEO of the Institute for AI Governance in Healthcare really championed and put this together. But with the Haigs, it's healthcare specific and it's scalable. So it can be from a primary care office to the biggest healthcare multi-acute system in the nation, right? And what it does is it gives you the step-by-step guide at each point of iteration of AI to how to implement guardrails, how to audit the bias, how to implement frameworks, etc. So it encompasses, each of these standards, right? ISO, NIST, RMF, Haigs. They all have, their own little niche of proprietary information, if you will, but they overlap. So the point I'm making here is Haigs includes everything that ISO and RMF does and more because it's healthcare focused. So it doesn't give you ISO or NIST certification, but it includes everything and more that they have published.
And tell me a little bit about some of that more, quote unquote, that this has as sort of purpose built for healthcare as it is,
Well, the more is practical for us. So like how much more, governance or guardrails can you make, right, in a situation? With the Haigs standard, we've created a whole training curriculum and training system around it. So with that, we have, I think it's 36 templates, right, or training and training materials to go along with it. So as you're implementing it across our template. So for lack of a better term, a crosswalk. Here's our Haigs, and here's the template as you're implementing and walking along with it.
So can you like flesh that out? Because this is, so I think I understand from like a theoretical kind of cerebral perspective, but maybe we can walk through like a use case on how one of these templates, how somebody's going through the certification and like an actual healthcare use case might be able to leverage that kind of a thing to, again, de-risk the organization they're a part of.
Yeah, I mean, like a simple one like bias auditing, right? So
Yeah.
in
Okay.
healthcare, you have the whole gamut of a population from one spectrum to the other side. So what is your AI being trained on? What data is it being trained on? What population background demographics are you being trained on, right? And how is that being implemented and operationalized in a healthcare setting? There's a template for that you can go and audit, step-by-step roadmap of how you've implemented that. And then there's a human in the loop, overarching principle, where you're monitoring each step of that. So you always want to make sure that none of your data you're inputting is biased, because that's going to affect the outcome of your AI. So implementing a template like that, right, in a structured way. So maybe you don't even know some of the steps, or you weren't even privy to the original data sourcing. So implementing a template like that is going to ensure you can track back right to the beginning, audit right to the beginning, to wherever you're at.
Do you find most in healthcare are people using just open models that are kind of corporatized with like the privacy settings? Are they using something like that? Are they using kind of their own models that they're training on their own data? Or are they using sort of, quote unquote, B2B models that they're buying from somebody else, like as part of an existing tool? Like it's probably across the board, but like, what are you kind of seeing, and how does somebody who's using an open model end up applying some kind of like audit of bias in those models? Because I think you kind of run the risk of like, I don't know. I'll say this in a second, I guess. Go ahead.
No, you're absolutely correct. I'll answer it first. They're using a common, there's all of those are being implemented across the board, right? But I would say a majority of them are using the pre-existing open LLM models. Again, Gemini, Grok, all of the ones we know offhand. Because they just don't have either the technical capacity to build a small language model. Maybe they don't want to, or maybe the budget, it's a budgetary concern. And, there are differences in compliance with a small language model you created as an organization, and then a large language model you're just plugging into, for lack of a better term, in a bigger organization. Now, if we go with the latter, with a bigger organization, how are you going to get the training data? How are you going to go into OpenAI or go down to, X, XAI, I guess it is now, or Google? They're not going to just go and say, here's everything we trained on that's proprietary. Yeah, totally. Right. So you have to go with, here's where we are now, right? We got the open model. I'm not OpenAI necessarily. Open model keyed into our organization, whether we're using it as chatbot or research or an agentic AI, whatever you're using it as, you have to, before you've even integrated with it, you have to have a very strong governance framework in place. Because once that's implemented in your organization, sometimes there's a lot of automatic things that are going on in the background, not just your customers or employees interacting with it. So you have to be data strong, focused in the beginning for that, with governance.
Do you think it's an ongoing process, or do we run the risk of checking it once and just being like, this is good to go? And what I'm kind of talking about is this, I don't know what the term is, but it's something that I've seen I think it's kind of a human thing. It's like, if you hire an assistant, maybe off the bat, you're reviewing every single thing the assistant is doing, right? This is like an admin or something who's writing emails for you or something. You're probably working with them pretty closely to say like, okay, no, don't do this. Okay, yeah, do this. At some level, if you keep this person over, a reasonable amount of time, you're probably not you're probably not checking it so much. Like if I hired a copywriter to write blogs for my company, I'd probably be checking them a ton. And once they kind of pass the sniff test after some amount of time, I get like comfortable, like, okay, this person is competent. I don't need to like comb through every single blog post with like a fine tooth comb. I don't know what the name for that sort of, it's kind of the equivalent to the forgetting curve or something. Like over time, the level of oversight just naturally drops as you get more comfortable with some resource that you're relying on. How do we avoid, I don't know, maybe I'm kind of, maybe you can see what my cynical bias is. How do we avoid that over reliance on something that is an open model that we have no ability to like have visibility into the black box that is this AI brain, how do we ensure that there's not more bias sort of creeping into it over time or whatever, right? Like, how do we actually govern it without this turning into sort of some kind of like compliance or governance theater that's not actually de-risking the outcomes that we're relying on?
Yeah, and it's a great question, because my overall, again, sentiment to anyone I consult with, advise with, work with AI, Gen AI, is that we are nowhere near the maturity level of AI being allowed to be autonomous, especially in healthcare. So my general rule of thumb is human in the loop everywhere. So from the time if it's on this, development IT side, data side, human in the loop. Well, if that doesn't pass the sniff test or doesn't look right or sounds hallucinatory, and Gen AI can do that, every model can do that.
Totally.
Then you're the checkpoint. We need checkpoints at every iteration of it. So from the data folks to the product folks, to the sales folks, operation, every level of this. And I could give you an example of how an incident almost occurred, but a human in the loop saved it. So I am, I'm VP of compliance at SolvedHealth right now, and we have a product called EM Team. So EM Team, which is available on your app store, we have AI-based gamified scenarios where paramedics and EMTs can earn CAPC credits towards their renewal of their certification, within their research period. So we're working with, Gen AI to create those scenarios in our app so that the practitioners can take them and learn and progress. Well, one of the developers who helps with the scenario creation pinged me, and he goes, "Hey, I just wanted to bring this up to you. I've been doing these scenarios today, and I've been noticing that every, because we put a picture out of the scenario. Let's say it's a car accident. We'll have a car accident picture, right, to set the scene." He goes, "The pictures I've been doing today for all of our scenarios, the Gen AI is spitting out only Caucasian providers." He's like, literally dozens of pictures, different scenarios, all different medical trauma, this and that, but it's always spitting out Caucasian providers. And I go, "Thank you for catching that." And that's why we have a human in the loop. Because if you would have let that go on and just go, okay, it doesn't look bad, the picture doesn't look like they have 5 arms or, the silly AI stuff we talk about, you would let it go because, you're not minutely looking at everything. But, the human in the loop is so crucial, because if you let that go, and someone in the app catches on and go, "Man, every scenario I played for the last hour has been a Caucasian provider and I'm an African American. What?" And then you're opening the door for, legal issues. So the bottom line is human in the loop is crucial and nowhere near anywhere being taken off the line. Sorry.
Yeah. No, I was just going to ask you, I heard this thing at a conference last week that I'm kind of adopting, and I just would love to get your perspective on it. The concept is not human in the loop, but expert in the loop, because if I'm a compliance professional, a compliance expert, and I'm using AI as a kind of level 1 or maybe level 2 brainstorming partner, and it gives me back some hallucination, I'm ready to say like, "Oh, well, that doesn't make sense because that's not considering the OIG guidance, or that's not considered, it's just very confidently putting something forward that I can catch because I'm an expert." But if I also, as a compliance expert, am using it for some brainstorming that is outside of my, sphere of expertise, the rate at which I'm able to identify hallucinations that could be wrong drops dramatically. There was this study done where, this, you're an AI expert, but there was a study done where they tested these large language models to develop a business plan for a number of different businesses. Did you hear about this thing?
I think I have,
So
but
interesting.
refresh me. Yeah.
So, they had like 20 different businesses, 20 different startup ideas. And they said, "Hey, develop me a business plan for this, for, business plan A, or, business A, B, C, D, all the way down." And what they found is that I'm going to overstate this, but 80% of the business plans were kind of the same, irrespective of the type of business, whether it's a plumbing business, a plumbing app, or a service business, or a different SaaS business, or whatever. There's all these different, this wide sort of spectrum of different business types that all ended up getting back really well-baked, seemingly logical, business plans and like marketing plans, for all of them. And if you're not a marketing expert, or if you're not like a business expert, you could say, cool, this is a great business plan that I'm going to apply to my plumbing business, when really it's really more purpose built for, I don't know, a software business or something like that. So how do you deal with the potential false sense of security from a human in the loop, given the wide breadth of sort of knowledge or expertise that can seemingly come out of a large language model?
Right. And I agree. I would say that one of the greatest tools you can have, and I'll stop harping on it after this, is the human in the loop. I think that, and I'll give another example at Solved Health. We have different teams doing different things, whether that's dev and IT, or product, or teaching and business intelligence. They are the expert in the loop. So like if you were to plug me into the product team, it'd take me a long time to get up to speed at where they're at, where they've been, what they're doing, the issue of the day, whatever they're dealing with. But we have, between our chief product officer and their team, you have those experts in the loop. So when it comes from the scenario to them and they're looking on polishing it up and putting it into the app, they're again going through it. Where do we notice anything? Like our chief medical officer, I think I said before, I was an EMT, but I was never a paramedic. And for your listeners, there's differences between EMTs and paramedics, but one of them is, pushing medication. So injecting medication or the like. EMTs don't do that, paramedics can. So if there's a scenario spit out that has these meds mixed up and put it in my right leg, or, just total nonsense, you got to catch that as the medical professional. Even though it's written very eloquently and professionally, it's all nonsense in a medical sense. So we have our chief medical officer to review them as well. And all of the scenario generation team members at Solved Health are all paramedics. So they would know the medication, for whatever scenario they're creating. So there is experts in the loop, at least, for the organizations I'm working with. And if
but it sounds like what you're saying is that the best practice is not just a mere human who has a pulse and can fog a mirror in the loop, but rather somebody that has at least their own context to be able to kind of filter through the responses that are being generated by the tool. For
sure. And I think it goes back to, what I said originally is AI right now is not sentient. It's not general intelligence yet, but it's a tool. And it's a tool that we can use as humans to better do our jobs, or better, effectuate change, or whatever we're doing. But you are still the human. You are still the owner of whatever outcome, is produced. And I think that's important, because you can't sue or put in jail an AI. But if you're negligent, or, some other, thing that you've done, you're liable. So, you're going to jail. So I don't ever want to put out something that's, hallucinatory, or half of it is BS in the, the framework, because AI helped me, collate a lot of these regulations. So I always want to be that double check and that expert. So I don't think it's just merely a human in the loop. You're right. It's an expert in the loop, particularly in these high intense, stake situations, whether they be healthcare, emergency management, public health, legal, critical infrastructure businesses.
So what are some of the biggest AI risks or ethical risks driven by AI in healthcare right now? You talked a little bit about bias. Where is it actually showing up in real use cases right now?
So I think there's a lot with data. So we don't always, forget AI just for 1 second. We don't always have perfect or complete data in general, to work with. So you have to be aware of that going in. Of course, you will give the best data or the most clean data you can give to an AI, but not necessarily always. So you have to be able to audit that data. And I think that's where, there's some issue in healthcare is, where's that data coming from? Can we support that data? Is it complete? And, when you translate it into AI, is it, going to create a bias outcome because it's incomplete. So I know that, it's, again, repeating the same. I think another issue is rural versus urban data. So I live right now in northern Maine. I know I said I'm originally from New Jersey. I moved up during the pandemic, the Great Migration. But we are in a rural health desert up here. Very limited access to specialty care. A lot of the services a normal hospital would offer, like surgical specialty, you have to go downstate or to Boston. So up here, you don't have complete, data for a rural region, but also, are you feeding in rural data and urban data to your healthcare system or whatever you're using AI to get, the outcome? So you may be missing half of the swath of population of America because half of it's rural or more. So I don't think there's a match yet of complete data between urban and rural, and then the outcomes being equal for both.
What do you think about the this lack of sort of a unified, framework for AI governance, or a lack of sort of a unified, governance framework in general for healthcare, let's say? Like, how does that ambiguity play out in the day-to-day? Do you feel like it drives too much chaos? Do you feel like it's causing compliance teams in general to be too slow in adopting this thing because it feels like a third rail? Like, what do you think the true implication of this lack of, or that this ambiguity stemming from this lack of sort of a cohesive kind of governance, framework has on healthcare?
Yeah, I mean, well, you're opening yourself to legal liability, because what are you basing your actions on, right? Well, we only have this framework, that framework, and this standard. We don't have a national USA AI Act, right, or legislation.
Right.
So, we're all operating from that ambiguity. That's why, someone like me exists, to come in, to help, make that puzzle piece come together into the unified picture. I want to say, though, that Europe is far and away ahead of us in the U.S. in AI legislation, regulation, and, ethics and compliance. Their governance is way and above what we have. I'm also part of the Association for AI Ethicists, and most of our members are in Italy or France or, in Western Europe. And they're always, sometimes I'll bring something up, not thinking of it. And they're like, yeah, that's in the EUA. Yeah, we already have that. That's baked in. That's caked in. It's concrete foundation. And we're over here going, oh my gosh, we haven't even put an act together yet. So again, I would say, look for people like myself who have the expertise. I did do a couple programs at Oxford for AI ethics, compliance, and regulation. They also gave some frameworks to utilize. Again, I'll bring up the Hague's, the Health AI governance standard. Again, if you're not in a healthcare industry, there's the ones that you can look up, which is the ISO and NIST. But you can only implement what you have. So you can't just say, well, this is what the U.S. legislation will look like, we imagine. You can't do that. So you can only implement what you have. So again, I think it's key factors are the data. Where are you getting the data? How are you implementing the data? Is it biased data? Then when you're implementing the AI from whatever function you're utilizing it is there governance around it? Do you have frameworks? Do you have standards? Do you have policies in place? Who is that human in the loop? Who is the person, for lack of a better term, the AI business owner? So when a problem goes wrong, who do you contact? I'm sure 999 out of 1,000 times, it's not going to be the CEO, because he knows less than most people, or she knows less than most people in that organization. So you have to have that accountability. And again, human in the loop. We're nowhere near past human in the loop yet. You need those checkpoints and those guardrails in place.
Do you think, given all this ambiguity, given how fast AI is moving, given how easy it is now for somebody in a specific department doing a specific job to leverage one of these large language models to solve a certain task, right? Like, there is an explosion of use cases that are really kind of across the board. It's a function of the skills, the context that's provided to it, and things like that. Like, do you think that compliance and ethics professionals are even equipped to handle these AI related challenges?
As a whole, I don't think yet, but soon. like I did myself. I think you need to upskill and reskill your workforce, especially compliance. And, if someone comes in and goes, well, where do I start, or what's out there, or what's applicable to me? There's a lot of free or very low cost training certifications out there. I know people are probably familiar with Coursera, which is like an open model for learning. A lot of universities put their certificates up there. So there's a lot of things that compliance officers can do today to just reskill very quickly. Again, I think I don't remember the organization, forgive me, but they offer the Certified Healthcare Compliance certification. And I know I read recently that organization is putting out AI learning modules. So a lot of the organizations compliance or AI or ethical practitioners are in today is already transitioning to AI application. So I would encourage them to go look at, their associations, trade associations, or the like, to see what information is available, especially outside of healthcare.
This is just a vibe, but it feels like so many people are just, they don't know where to start with it. And so sometimes when you don't know where to start, you kind of procrastinate on it. And this is at a time where it's moving so fast that the gap between kind of what's actually happening and, an individual's, knowledge of this technology kind of is just, it's expanding so much, which makes it even harder, right? Like the molehill is turning into a mountain. What would you tell somebody who feels like it's moving out beyond their, I don't want to say control, that's the wrong thing, but at least their kind of purview or like what they understand? Is it merely just like, hey, jump in the pool and start kind of playing around with it, jump in the pool and start learning about it, getting some certifications? Like, how can they accelerate forward? Because I think, again, maybe I'm leading the witness here a little bit, but I just want to kind of give you some background on where this question is coming from. I think in general, people in the compliance space are usually a little bit more risk averse than the average person in the organization, and they're a little bit more conscientious than the average person in the organization. And so you have these lower risk aversion, lower conscientious people diving in, not sort of thinking about how things might go wrong, that are stakeholders in the organization, that the higher conscientious, more risk averse compliance folks who are, at some level sort of responsible for the behavior of, doing things that are creating, risks that aren't even on the radar for the compliance people, kind of to some of the points that you were making before. Right.
And, if we're just speaking to the compliance folks, let's say in an organization, first of all, it's not just going to fall in your lap. The understanding and knowledge of generative AI and AI isn't just going to come to you. So you need to be proactive and persistent. And I would say even more important to that, if you are leading compliance in your organization, you're going to ultimately be responsible for your employees' actions within that organization. Exactly. So I will give you this. If you're a compliance officer now who hasn't really touched AI, and, let's say you're an organization with 50 or more employees, I will tell you this. There's people in your organization using AI at your work right now, and you don't even know it. So do you want to continue to be behind the eight ball, not creating governance frameworks? You're opening up liability to yourself. So I would say with compliance is be proactive. You have to go out. I mean, if you're really behind the eight ball and you're like, I don't even know, I just heard of Grok or Gemini and all these, what are they? Go download them. They're free to just talk to them. If you want a higher level of, work with them, it may be added costs. But for what we're talking about here, just go to the source. If you heard about the internet and never used it, I'm not going to give you a pamphlet to read about it. I'm going to say, go to the internet and go use it. Try
that's
it
a good
out.
example. Also, how do you build a social media policy, a fair use social media policy, or an internet use policy if you've never been on the internet? How can you govern something that you know nothing about, to your point?
Right. And of course, like I said, there is ambiguity out there, but there is standards and frameworks that are, can legally protect you, right? To, as much as possible, right? I don't want to just say it's just going to protect you all over, because if an employee does something really stupid, well, you're in a catch-22 there. But, there is governing documents out there. People like me who can help with consulting. Again, you can look this up. You can chat with AI if you're really just trying to get a foundation of what it is. But there is resources out there to implement. But I would say to any compliance practitioner right now, you're behind the eight ball if you haven't started, and you need to.
Yeah, and as a word of encouragement to anybody listening, if you feel like you're behind the eight ball, I think it's important to reframe what your value is to the workplace or to your industry or to your department. Your value is not in what you know. Your value is in your ability to learn and your ability to flex into new things. Because there was a time where none of us could even speak a language, right? We were babies. We couldn't even walk, right? Like our whole life is just a life of acquiring new perspectives and skills and so forth. And that should, and the pervasiveness and sort of the size or the magnitude of this new technology, even if we're not like super tech savvy, should not prevent us from applying that trend of learning more and being flexible and absorbing new, like I said, perspective, skills, whatever, in line with this thing.
Right. And you don't have to be an AI expert, like a programming, IT development background expert. I am not. The only thing I know about Python is stay away from one because they bite. Like, I don't know how to program anything other than like prompting, regular prompting. So I don't, I think there's a lot of hesitation from people diving in because they're like, oh, I have to learn HTML or, C++, whatever they think they may have to learn a, more programmatic language. You don't. Just start.
And I think we also run the risk of, you can spend all summer learning, reading books about how to ride a bike, but if you don't get on a bike, you're never going to be able to ride one. You know what I mean?
Right.
I think in our space in particular, I was at a conference recently, and if I compare the vibe at that conference to the vibe a year ago, it seems like the openness to AI for day-to-day use in compliance, or the fear and skepticism around AI has definitely like reduced a bit over the last 12 months, let's say. But it still seems relatively high as I compare that to other industries or other people I talk to who are in marketing. Like marketing is all in on AI. You know what I'm saying?
Right.
So what would you say to somebody that's feeling either frustrated by the pace of change or skeptical about this new technology? What would you say to kind of shift the conversation to something that's more constructive?
I do hear a lot of skepticism and fear about AI. Personally, I believe that unless the sun explodes, AI is going nowhere. It's here to stay. It's integrated. I think unless a catastrophe happens, it's going to be here. So I think those who are saying like, it's just a fad, or, we're going to realize it's not what we want, I don't think it's true. I would say, especially those who are skeptic about AI ethics, like AI has no ethics. Well, wouldn't you rather the AI reflect yourself in a mirror? You have to embed those systems into, the ethical framework. So whether it develops into AGI will be too late, right, to embed them. So I think, and we're talking about these high stakes industries, healthcare, disaster response, public health, all that. I don't want to get to a point and it's like, oh man, we forgot to put ethics and governance into this AI. And now it's telling, don't worry about those people down the hill. They're going to be dead soon. Well, you don't want any, that catastrophe scenario rolling out. So I think it's about reflecting our own values in that AI and ensuring that it develops as such.
It's almost a silly argument, though. Well, to me it is, but I'd love to hear your thoughts on it. When people say that AI has no ethics, it seems like it's said as sort of a justification for their aversion to it. But I don't know, a car doesn't have ethics. A tree doesn't have, there's 1,000 things, a scalpel doesn't have ethics. I think only humans have ethics. So like, what do you say to that? I'm sure you've come across this sort of quote unquote argument. Let's kind of deconstruct that a little bit. Like, what is that rooted in? What do you say to somebody who's thinking that kind of to let them sort of see the light?
Yeah. And, kind of piggybacking off what we're talking about is like, first of all, everyone likes to compare it to some non-life, regular object, some widget. Like you were saying, this microphone has no ethics, car has no ethics. Yeah, well, guess who else doesn't have ethics? A sociopathic human. But they're human. But you still have ethics for the humans, right? So you don't want to develop a sociopathic generative AI that goes, forget humans, nuke them all. That's really worst case scenario. And then we're in real trouble. So I like to start there and go, yeah, well, if you like to say other things don't have ethics, well, humans who are sociopaths don't. So I like to dispel some of that there. I would also agree with you. I would say the majority of those who bring it up or similar to that is pushback because they don't want to accept AI in their day-to-day life. Sometimes I like to, be very straightforward. I'll say AI is not going anywhere unless the sun explodes. So I like to set a foundation of AI is here, right? The internet was here, right? I don't remember back then, but I bet you there was anti-internet people. Maybe not to the level we have today with everyone being connected, but there were, I'm sure. Don't hear about that much anymore. So you're always going to have naysayers. I think you can also reframe it in a positive light to them. So it's if they want to just harp on ethics and not having it, you probably are just going to be at a stalemate if they just won't listen. But I think you can show them use cases today, right? So implementing Gen AI into healthcare or into business or what have you, and show a couple outcomes that have been positive. I think you can turn it around. Some people will always just want to not hear it, though.
Well, I think you're right. There's always going to be people that just don't want to hear it. In my work with compliance folks, though, there has always been, we're human beings. We're like excuse machines. We can always make an excuse. And the big complaint for so long was, man, if I could just add 5 more people to my team, or if I could get a marketing, if I can get budget to get a marketing person on my team, then my internal comms would be so much stronger, whatever those things are. I think at some level, this allows you to get at least a bunch of interns that are going to allow you to be this sort of, or to take advantage of this force multiplier and really ultimately drive more impact forward. It's not without its cautions, to your point. It's not without guardrails that we have to implement and so forth, which is kind of true for everything, right? But I think the way I look at it is that it's to your point, it's not going anywhere. It's probably going to be more pervasive than we could even imagine. The internet's way more pervasive than anybody could imagine back in 1996 when, Paul Krugman was debating whether it was just a souped up fax machine or whatever else. And, nobody had a freaking website yet. It could be way more pervasive than that even. And of course, there's going to be a bunch of positive and negative externalities. I was watching maybe as a TikTok or something showing that the percentage of today's people who could even open up a map. This is a big thing, right? You used to be able to open up a map and you would chart your course to your destination before you left the house. Right. Most people don't even read a map at all. So that's perhaps a negative externality, a quote unquote dumbing down of human beings because we can't use, maps and coordinates and stuff we used to be able to. So there's always going to be some externalities, right. But to your point, it's the reality of, it's a sea change. It's a new, I don't know. It's kind of here to stay. So we have to figure out a way to leverage it to the extent possible and guard against the negative externalities to the extent possible. Right. Yeah. And a lot of what we've been talking about today has been open model, how do I start with AI or what's my first use cases? But it's also important to remember that a lot of these open models have a premium tier or, extra AI usage for your questions. So I'll give you one example. Perplexity, another open AI model, has what they call Perplexity Computer. So it is an extra cost. You have to buy a little more credits. But in essence, what it is, you have 20 agents, right? If you go to ChatGPT or Grok or Gemini, it's normally one agent answering your question for the most part, right? Yeah. Perplexity Computer has over 20 agents working in a sandbox, so an enclosed workspace, to generate whatever you've asked it to generate. And it will give you so much more in depth from that, the deliverable, than what any of the open AI models will. That's actually a great point. Yeah, right. Well, so because a lot of people are judging the quality of it based on some free model where there's, several tiers more, or several, more dimensions of capability that they're never even sort of gaining visibility to or something. Right. And I think that's important, especially for compliance, because we're dealing in details and we're dealing in copious amounts of data or paperwork, documentation, policies, etc. And these higher level performers, if you will, AI agents, the quality of their deliverables is so much better. It's almost like night and day. So just real quick example, we were working on some grant, spinning up our grant program at SolvedHealth. I don't come from a grants background, but I took it on myself. And I'm like, there's got to be some AI help out here to get me jumping off point. So Perplexity, you create a very
succinct,
specified,
right, specified prompt. And it worked for an hour and 20 minutes. I'm just sitting here in the background. It spit out a whole Excel sheet, 5 different applications with every question answered to apply to these very lengthy federal grants. And I was like, wow, that would have taken 3 people weeks to do. And it did it in an hour and 20 minutes. And, I just want to give that as an example because it's like grants are compliance, right? You have to be compliant to apply. You have to be compliant throughout and, to the end report. So it's such a great use example to go, look, I just gave it this prompt. I'm not into grants and it printed me out the start of our grant program. So it's like
crazy.
Compliance, practitioners, even without really having AI knowledge, can get so much value out of, deliverables from them.
It's crazy. It's what a time to be alive, man.
Right.
We were built for this time. We were born at this time for a reason,
Right.
All right. I always love to wrap up on this question, Jordan. If you could go back in time to a young Jordan and give him a piece of advice that you wish you had earlier, what do you think that would be?
That's a good question. My general question, I think, all of us have been young before, is just slow down and be open to learning more. Be receptive. Not everything has to happen next week or next month, and understand that patience, is a very, very valuable virtue.
I love it.
Yeah.
Jordan Henry, the one and only, thank you so much for joining us on the Ethics Experts, man. This was a great episode.
Awesome. Yeah, definitely. Thank you so much. And talk soon, I hope.
Yeah, same here. See you next time.
Have a great one. Thank you. Bye.